So hello everyone, myself Dr. Sandeep Dahilekar, Professor in Rog Nidan, the coordinator of this pedagogy session. Today we have our 49th pedagogy session. For that we have our resource person Dr. Anjana. She is a professor, assistant professor from Dravyagun department. Dr. Anjana had her BMS, that is, she is consistently secured first class in all the academic year in the single attempt at Sri Sri College of Ayurveda Science and Research, Bangalore. She presented her scientific paper in reputed journal in the first year of BMS. This is the great achievement that first year BMS student is presenting her paper is the very nice and very impressive thing. Her post graduation in Dravyagun from the same college, that is Sri Sri College of Ayurveda Science and Research, Bangalore, presented many seminars at the national and international level. The interesting part is that her thesis is very interesting, a comparative experimental study on the species of guduchi, that is Ctenophora cardifolia, that is its T. malbarica and Ctenophora crispa. These are some species from the Ctenophora, and we have our PhD regarding the same for antipyretic use animal study and furthermore for Ctenophora crispa related. So her thesis is comparative experiment study of the species of guduchi in sattva form with respect to antipyretic and anti-inflammatory activity. She writes many more articles. Some of those are an article on agencies of isthmus in the thyroid gland in Jnana Srotas, a comparative evaluation of the species of guduchi, that is Ctenophora cardifolia, in sattva in uh, Ayush Dhara, an international journal research in Ayush and allied system. The analgesic activity of the Sebastiania Camilla Muley, that is a journal, it is published in a journal of advanced research of Ayurveda, Yoga, Unani Siddha and Homeopathy, that is ADR publication. A novel approach on the systemic drug, International Journal of the Future Generation Communication and Network. The critical analysis of concept of Desh in Ayurveda Classic, International Journal of Disaster Recovery and Business Continuity. Her next publication in the traditional healing practices among the indigenous people of Kumaraghat and Unkoti district, Tripura, in the Journal of Drug Research in Ayurvedic Science in JDRAS. The medicinal plant in the local traditional, that is LHT, in Dharmanagar subdivision, Tripura, India, in the Journal of Drug Research in the Ayurvedic Science in JDRAS. The medicinal plant in the local health traditional, the Dharmanagar and subdivision Tripura, India's, in the Journal of Drugs Research in Ayurveda Science. And her next most important is the ethno-medical importance of the traditional medicinal plant among the indigenous people of uh, Kanchanpura subdivision. Her professional experience, she is just now assistant professor in Parul Institute of Ayurveda, Parul University, Vadodara. The senior consultant she was in research Ayurveda Research Institute, Itanagar, in January 2019 up to March 2021. She is a consultant physician in uh, Trinica Enterprise, Itanagar, the same period. and interns in Sri Sri College, Ayurveda Science and Research Hospital, Bangalore in 2014 and 15 of the North Tripura district in JDRAS. She presented near up to many papers. Some of them are, she presented a scientific paper on the oral hygiene and dentistry with the reference to role of Triphala Gandush at Global Wellness Meet under KAUP at Bangalore. She presented a poster on the maternal health and the nutritional at the third Global Ayurveda Festival, Calicut, Kerala. She presented a scientific paper on the integrated management of health need of our special focus on the diabetes at 31st NIMACON and AREC Expo All India Conference. She participated as delegate and resource person in the technical session in Ayurveda Parv Bangalore. She participated in the presentation contents by Himalaya Drug Company. Furthermore, she participated as a delegate on the research methodology and biostatic communicating science and research ethics. She participated in Madhumeha Madhumeha Jignasha, a national seminar as delegates at Art of Living International Center, Bangalore. And she had many more things, but due to a lack of time, I am concluded here. And the madam, I am requesting you to start your session, please.
Thank you, sir. Thank you for the welcome words. Uh, I would like to start this pedagogy session, and before that, I thank sir for introducing me, and I welcome all the members for this pedagogy session. So please let me know if the screen sharing is visible. So is it visible?
Yeah, madam, it is.
Okay, so we will start with the session. The title for this session is Understanding the Role of Drugs in COPD. These are the contents of the presentation. First, we will see the introduction, then a little bit about the pathogenesis of this disease, and then the drugs and its key features, followed by that, some folklore practices which are famous in this aspect. Then, Adravya Bhuta Chikitsa. Later on, we will go to the discussion and thereby conclusion. So, coming to the introduction, COPD can be termed as a disorder of pranavaha shrotas as etiological factors and clinical features described in Ayurvedic classics for pranavaha shroto dushti are nearly similar with those of COPD and occurs usually in the prolonged conditions of Kasa or Tamakashvasa. In Ayurveda, respiratory diseases can occur due to involvement of pranavaha shrotas where cough, breathing difficulties, disturbed respiratory pattern occurs, and though it is impossible to correlate COPD with any single condition of pranavaha shroto dushti, but advanced conditions of doshika kasa and tamaka shwasa may result into COPD. Coming to the pathogenesis, in COPD, the inhalation of toxic substances, particularly inhalation of tobacco, smoke, or any other kind of toxic materials in the form of smoke can cause inflammation of the lung tissues. And this inflammation in turn can cause tissue damage if the normal protective or repair mechanisms are overwhelmed or defective. The result of the lung tissue damage can cause mucus hypersecretion, which will follow by airway narrowing of and fibrosis, thereby destruction of the parenchyma and vascular changes. These pathological changes lead to airflow limitation and the other physiological abnormalities resulting into clinical features of COPD. In classics also, pathogenesis of pranava shrotodushti described in regards of kasa and shwasa resemble the above mentioned features or the description, and that can be summarized as due to indulgence in etiological factors, vitiated prana and udana, vayu situated in the pranavaha shrotas, enforcing the kapha, resulting into the obstruction of channels of pranavaha. On the basis of this, it can be said that the pathogenesis of COPD, which will involve the following steps. It will first have an airway inflammation due to the inhalation of the toxic materials, which is in the form of smoke or other gases, thereby hypertrophy of the secretory glands, and then increase in the number of goblet cells of bronchi, then the decrease in the number of ciliated cells resulting to mucus transport becoming less, and then the airway obstruction and loss of pulmonary elasticity, and hence there is the clinical establishment of COPD. Now let's look at some of the single drugs which are helpful in this condition. Ardraka, Vasa, Ela, Haridra, Trikatu, which is of course a combination of few drugs. Pippali, Ashwagandha, Agnimanta, Rasona, Ajumoda, Ajaji, Guduchi, Ativisha, Aragvada, Karanja Bija, Daru Haridra, Lashuna, and Hingu. Let's look at the drugs individually and their properties as well as the mode of action, how they are acting in this condition. First is the Vasa, which is having Tiktarasa, Laguguna, and Katu Vipaka, is helpful in reducing the Kapha and has also reduces the Samsthana doshas. Talking about Haritaki, it has Laguguna, Rukshaguna, as well as Ushna Virya. This has the property of normalizing the Gati of Vata. Pippali has Rasa and Tikta Guna, which will do the Agni Deepana and Rochaka property. Bharangi has Lagu and Ruksha Guna, which will do the Kapha Shamana. Tulsi has Lagu and Ruksha Guna, Kapha Shamana, and does the Pachana of the doshas at the Dhatu level. Haridra, Shirisha, and Dhatura together are having predominantly Kattu and Tiktarasa with Tikshna Guna, which has an activity which is doing an action on Amavisha as well as the exogenous substances. As we have previously seen that the toxic inhalation of the gases are also going to cause this condition. Nagara has Guru and Ruksha Guna with Tikshna property will do the Deepana and the Bhedana of Amadosha, and then the Ajamoda having Katurasa, Ushna Virya, and Kapha Vata Shamaka property does the Agni Deepana. Vasa has a Lekhana and Kledana action, which will help the irritation in the throat, and the expectorant will loosen the phlegm deposit in the airway, and thereby this will help the expectorant activity of the drug so that the phlegm will come out of the airway passage, which is causing the obstruction and thereby leading to COPD. Ativisha, having Tikta Katu Rasa, Ushna Virya, and Amapachaka property, will do Deepana, Pachana, and Joragna uh, properties. It will show. Next is the Musta. Musta is Lagu and Ruksha with its Shita Virya property. It will do the Deepana, Pachana, and Grahi as well as the Lekhana, thereby helping in the um, uh, Lekhana property of all the Amadoshas and the Kapha which is accumulated and lodged in the Pranavaha Shrotas. Uh, Next is a Tilasa, which has got Kasagna and Shwasagna property, which will do Agni Deepana, Vatanulomana, and Amagna property. Let's look at some of the folklore practices that are mentioned for COPD. Aniscoleus carnus. This is a drug which is belonging to Lamiaceae family, which is commonly called as kapuri. The vernacular names in English it is called as thick-leaved lavender. Hindi it is called as panjiri ka patta. Marathi it is called kapuli, and in Sanskrit it is known as ajapada. The picture here shows the image of the picture, I mean the drug, and probably because it has a very good aromatic smell, that is why it is called as thick-leaved lavender. And the habitat of
Slides are not moving. You first shut down your video. Okay.
I will I will share once again.
Uh, it gets stuck.
Is it visible, sir?
Yeah, madam.
Okay. The habitat of this drug is in the rock. In the rocky areas among grasses and sledges, Himalayan region, South India, Maharashtra, and Tamil Nadu, the chemical composition is camphor, luteolin, and epigenin, rich in flavonoids and phytosterols. The identification or the morphology goes like this: the leaf is simple and has opposite semi-succulent annual herbs. Flowers are bisexual, bluish violet, and the fruits are ovoid and it's smooth. Now, the remedies and the studies of this has proved that it works on the upper respiratory tract infection, mainly like cough and cold, with 2 teaspoons of the extract from the tender shoots on this species are given twice daily for 3 days. The acetone extract has also shown some promising results in the antimicrobial activity against Staphylococcus aureus. Next drug is Bridelia retusa. Now this belongs to Euphorbiaceae family. The picture here shows the image of how the drug looks. The vernacular names are spinous kyno tree in English, in Sanskrit Ekavira, Mahavira, and Hindi Ekanid and Kasai. It's a simple tree with the leaves are also simple. Inflorescence are spiked, flowers are unisexual, green tint with purple disc, and it is seen mostly grown in the areas of South India. This drug has an action on Pitta as well as in the Vata dosha. The Rasa Panchaka is Tikta and Kashaya Rasa, Laghu and Snigdha Guna Pradhana, Ushna Virya and Katu Vipaka. The chemical constituents of this drug are: bark contains 16 to 40% tannins, and there is triterpene ketone in the bark. Ripe fruit pulp contains beta sitosterol and gallic acid and allergic acid. The nutritional compounds are vitamin A, E, C, calcium, iron, magnesium, and sodium. The physicochemical investigations show that it is equated, and the studies are shown promising for anti-inflammatory as well as anti-arthritic activity done by using the bark. Now, the bark is subjected to the extraction using ethyl acetate as well as acetone. Now, the next plant is Adianthum caepilis. The botanical name goes Adianthus caepilis. This might be familiar, and it belongs to Pteridaceae family. And in English, it is known as walking fern, maiden hair fern, and in Hindi, it is known as Hansaraj. The description of this herb as goes as: the herb is a fern growing in the areas near water source and moist places. The fern grows to a height of 1 to 1.5 feet, and the leaflet is curvy. Oval stem of the leaf is smooth and reddish black colored. Now, the Rasa Panchaka of this drug is Kashaya Pradhana, Guru Guna, Shita Virya, and Madhura Vipaka, which does Kapha Pitta Shamaka, and the part used is a whole plant. And it has been useful in treating the antitussive properties. It has that property which has got good results in treating the bronchitis. Coming to the Dravya Bhuta Chikitsa, practice of pranayama, that is Kapalbhati, purifying the nadis, depending upon the type of pranayama performed, the flow of pranic energy may be increased or decreased in either one or more of the major nadis, that is Ida, Pingala, or Sushumna nadi. While Ayurveda also understands the role of pranayama in regards to prana, tejas, and ojas and their corresponding effects on the mind, relaxation along with conscious breathing of almost any type improves the functioning of respiratory system. Simple diaphragmatic breathing increases the volume of air moving through the lungs on inhalation and exhalation. It is reported that practice of pranayama and meditation enables patients to take some control over autonomic function, offering the patient an opportunity to relax and dilate the bronchial passages at the onset of asthmatic episode. This may also benefit the patient with additional breathing challenges such as chronic bronchitis. Yogic practices rehabilitation varies vital organs and makes them functionally more competent. Pranayama or breathing exercise plays an important in breaking the pathogenesis of this disease. Pathologically, there is mucosal inflammation, collection of inflammatory mediators, bronchial constriction, air trapping, later on remodeling of airways. To diminish all these factors, it is better to improve the lung functions by exercises, and that is by practicing the pranayamas, and to correlate and to correct the pathology. So stress was given to the expiratory exercises. Let's see some of the preparations which are mentioned in Ayurveda. Pippali Rasayana, Chavanprasha, Agastya Haritaki, Vyagri Haritaki, Haridra Kanda, Ashwagandha, Guruchi, etc. can be used as a Rasayana for this. If we are looking into the preparations of महालक्ष्मी विलास रस, लोकनाथ रस, व्योषादि चूर्ण, हरितक्यादि मोद, पिप्पल्यादि गुटिका, शितोपलादि चूर्ण, तालिसादि चूर्ण, व्याघ्रि हरितकी अवलेह. And then we can also complement these preparations along with some of the yogasanas like bhujangasanas, shavasana, shalavasana, paschimottasanas, etc. are helpful in the case of pranayama shrotas as it accelerates the blood circulation of the lungs and thus increases the vital capacity of the lungs. Some of the research papers which I have found for this are exploring the potential role of herbal Ayurveda formulations by Vasadi Kashaya in the case of chronic obstructive pulmonary disease. It was a review study which was published in the Journal of Ayurveda and Integrated Medical Sciences. The Vasadi Kashaya had made a potential herbal formulation for the management of COPD, and it has shown good results. Another one is the effect of Haritakyadi yoga in chronic obstructive pulmonary disease, a pre-test and a post-test design. This was published in the International Journal of Ayurveda and Pharma Research. With the objective of the study was to evaluate the effect of Haritakyadi yoga in chronic obstructive pulmonary disease, and this had shown having the Haritakyadi yoga having the properties of Kapha and Vata, Agni Deepana, and Rasayana property, which seemed to be effective in the management of the disease, that is COPD. Efficacy of Vasadi syrup and Shwasagna Dhuma in the patient of COPD. This was a clinical research which was published in the paper IU, in the journal IU. Here it has been described about how the symptomological closure of COPD can be achieved with the above said formulation, that is Vasadi syrup and Shwasagna Dhuma. Coming to the discussion, COPD is a Kapha Vata predominant disease in the spectrum of Kasa and Shwasa. In the Samprapti Ghatagas of Kasa and Shwasa, the main dosha involved are Vata dosha and Kapha dosha. Agni-mandya, Agni-janya, Ama, and Pranavaha Shrotorodhas are having major role in the pathogenesis of this disease. Agni-mandya and Shrotovrodha leads to depletion of the body constituents, that is the dhatus, and finally the Shaya Roga. This may produce weakness of the digestive fire because of the shrotomukhas are coated and obstructed, the dhatvagni being poor, and the rasa undergoes improper metabolism and remaining in its own place produces the various complications. Thus, the kasa can be considered as a progressive type of disease, and if it is left untreated, it will finally lead to shaya. COPD is also a it's also a progressive disease in nature with chronic bronchitis if not managed properly leading to emphysema. Early management is ideal in such cases with special reference to rasayanas. Now, the key features of the drug, let's see how the drugs individually are helping in the conditions of COPD. The extract of those drugs or the highlighting features of the drugs are Haritaki contains chebulin, which is having an antispasmodic action on the smooth muscles. Chebulic acid is anti-inflammatory and anti-phlegmatic. By its laxative action, it also helps in the correction of the bowels in COPD patients. In Nagara, the ethanolic extract is anti-inflammatory and enhances the bioavailability. The crude extract of pippali is found to be effective in improving the ciliary action and thus it is suppressing the cough reflex. In the case of pippali, the extract of pippali is also proven to be anti-allergic and study shows its action in reducing the bronchospasm. Musta is having an antibacterial as well as anti-inflammatory and action, and also it relaxes the smooth muscles. Antihistamine, anti-allergic action of the bharangi might be responsible for reducing the local congestion and checking the infectious microorganisms. Now, majority of the drugs are having Katurasa, Laghu Guna and Ushna Virya, Deepana, Pachana and Kapha Vatahara property. Since Kapha and Vata are playing a vital role, a major role in the samprapti of kasa and shwasa, the kapha vata property of the drug is believed to be the key factor. Katurasa is Deepana, Pachana, Shodhana along with Shofahara and Amapachaka. It can reduce the Shofa and it can also dilate the Shrotas. Bronchodilatory and anti-inflammatory action of Katurasa is essential for reducing the COPD severity. Haritaki and Pipali are having a Rasayana property and they are significantly contributing to this aspect. The drugs will act both on Jataragni as well as in the Dhatvagni level and thereby corrects the digestion, absorption, as well as the assimilation of the food substances. Amasha is pathological site of Kasa and the drug will correct the doshic disturbances and Rasayana property will give the sufficient strength to the structural as well as the functional aspect of the drug, especially lungs and the associated structures. Coming to the conclusion, due to the indulgence or in the etiological factors, vitiated prana and udana vata situated in the pranavaha shrotas enforces kapha, resulting into obstruction of channels. So, a drug having pachana, agni dipana, and kapha vatahara as well as rasayana property will be effective in the management of the symptoms and improving the quality of life. References regarding the lifestyle modification, along with treatment principles and formulations mentioned in Ayurveda, like Haritakyadi Modaka, Vyagri Haritaki Avleha, Pipalyadi Gutika, Agastya Haritaki Leha, etc., can be adopted for the prevention and management of COPD. COPD, being a chronic progressive disease with irreversible changes, needs early diagnosis and proper management. An extra care of diet pattern modifications, and lifestyle modifications with judicious use of rasayana can play a major role in the prevention or progression of COPD. These are the references that I collected for presentation. Thank you so much. Over to you, Sandeep sir.
So anyone have query? Yes, Ashokan sir, please.
Yes, sir. Very good presentation. Congratulations, Dr. Anjana. But I want to know what Ekala Dravyas or Ahara Dravyas in Dravyaguna we can do in preventive care, Pathyabhyasa. Uh, so if that can be mentioned and a Pathya chart can be drawn regarding Ekala Dravya Prayoga and some Ahara Vargas like Madhu Varga, Kshira Varga, Dadi Varga, Chakra Varga, etc. That would have been much helpful. Can you put some light on that?
Yes, sir. So the Ekala Dravyas, as you had asked, there are mentioning of, I have not put the formulations as such, how to use those drugs, but I had mentioned about the single drugs in the slide, like Nagara, Pippali, and such drugs which can be used. But of course, the preparation I will look into Bhaprakash Nigantu and also the Pathyas, also which are not increasing the Sthanika doshas or Samsthana doshas pertaining to Vata and Kapha dosha. Those can be included, but I'll surely look into the examples to put it and make it more informative.
Any more question, please? Anjana madam, as you know, COPD is a permanent change in the anatomy and physiology of the alveoli. So, do you explain any drugs regarding regrowth of that alveoli and lung tree or that bronchial tree?
Sir, as I mentioned, there cannot be one single drug which is reversing the entire process, like the entire. Hello.
Yeah, it is correct.
Yeah, so there cannot be a single drug which can be helpful in all the stages and which will be correcting the entire
Yes, madam,
pathogenesis.
we know the term bronchoectasis, bronchitis. So, can we reduce the spasm in lung field or bronchial tree?
Yes, yes, sir. if we have detected and early diagnosis has been made, if it is the spasm that is causing the obstruction in the airway pathway, then there can be drugs that can be used for reducing the spasm. But since there are no much clinical researches which has been conducted, it will be difficult to what percentage the drugs, single drugs, can be helpful in the condition.
Okay. So these drugs are apart from dilator or they are antispasmodic in bronchial
They
disease.
are working on the spasm as well. Like how we have expectorant activity seen in the vasa, there are which can be seen in the case of like Pippali, Nagara, etc. Can be helpful in this condition.
Very nice. Furthermore, any question or doubt, they can directly ask. So, madam, this is a wonderful session, and you have started with the short brief of pathogenesis in COPD, its classical reference regarding Kasashwas with Vyadhi Ghataka as Prana Udana. You explain very wonderful the single drug explanation of Rasa Guna Virya Vipak, and very interesting with its mode of action by Ayurveda means like Vasa, Haritaki, Pippali, Bharangi, Tulasi, Haridra, Shirisha, and Dhattura. Then with that, you again explain apart from your Dravya the Adravya Chikisa like pranayam under the term of different nadi, Shwasa nadi. Then you explain the combination of drugs apart from the single drugs. It is again Anubhut Chikitsa and useful in literature. Then yoga, the different respiratory postures which increase the oxygen saturation level in those persons who are suffering from COPD. And the discussion was very nice attempt to understand your presentation and drug of choice for the samprapti of uh, uh, samprapti bhanga in COPD with the drug action and its mode. This is the wonderful session, and you complete all the tasks. Congratulations, madam. Shall we conclude? Okay.